Hello friends, welcome to a new lecture today. In this, let us learn about the injuries of the breast. Sorry, I'll write in a new page. Okay. Let us learn about the injuries to breast. What happens if there is injury to breast? Any type of injury, any type of trauma to breast. So, first, this is the breast. Whenever there is some injury to the breast, maybe some blow, maybe some injury to the breast, then what happens? The blood vessels in the breast, they get ruptured, and that can lead to the formation of a hematoma. So whenever there is injury to the breast, the blood vessels which are present in the breast, the smaller blood vessels, these are ruptured and the blood will flow, and this leads to the formation of hematoma. Okay, so if you look, you will see that there is a lump in the breast. Okay, so this is one thing which occurs when there is injury to the breast, which is hematoma formation. Okay, the second thing which occurs is called as traumatic fat necrosis. So what does this occur? What happens here? Here what happens here is, just think that this is the breast, right? So now in the breast there is a trauma. It can be a direct trauma like this, or there can be an indirect trauma. Whatever it is, but the changes, some of the changes occur. So whenever there is trauma, I'm just going to enhance this view. Okay, whenever there is trauma in the breast, there are capillaries, right? I'll just draw the capillaries. In the trauma, there is capillaries. So from the capillaries, there is oozing of the tissues, oozing of the fluid outside. So this is capillary ooze. Okay, because of this trauma, there is capillary ooze. And here, there is complete fat in the breast, right? Here there is complete fat in the breast. So in the fatty, the capillary ooze is reaching. Once this capillary ooze is reached, so this capillary ooze will convert two things. One, this will convert triglycerides which are present in fat to fatty acids. Okay, so these fatty acids will combine with calcium. This is not calcium, this is calcium in blood. Okay, which is present in blood. So this calcium will also reach this fat, and this fatty acid and this calcium will combine together, and this leads to the formation of saponification of the tissues, like soap formation. Saponification can occur. This leads to inflammation. Okay, this will look like a swelling in breast. So this is called as traumatic fat necrosis. So what are the clinical features? As you can see, in the breast you will see a painless swelling is seen in the breast. In the breast you will see a painless swelling. This is painless, and you see this is hard and non-tender, and it is not progressive. The swelling is present, and that is already present, and it is not progressive, non-regressive also. So how are you going? What investigation that you are going to do? You'll have to do an FNAC. Is done. This FNAC, you will see fat globules, and also you will see a chalky fluid. You'll see a chalky fluid which is nothing but saponified thing, and which is surrounded by fat globules. And then you'll have to do a biopsy. This is to rule out malignancy. Okay, now once you have found out this, once you have found that it is a traumatic fat necrosis, then the main treatment that you can do is excise this lump. So this is what we do. So this is about traumatic fat necrosis. So thank you guys for watching my lecture. If you have any doubts, please comment in the comment section. Thank you for watching my lecture. Thank you.